This is the lecture on project execution by Professor Alemi. In the execution phase of the project, managers do 6 different tasks, including completing plans, managing project resources, encouraging teamwork, communicating project's progress, managing project issues, and conducting quality control. In healthcare projects, project managers are typically supervising professionals who do not follow plans and who do not feel responsible to the project manager. It's important to keep these professionals motivated and focused on the project plans. In these situations, effective management does matter. Unfortunately, most people have wrong ideas about what is management. They think that their common sense ideas will work, but management is more complicated, and management of professionals is especially difficult. The key to motivating professionals is to get them engaged in planning for change. Professionals are more likely to complete a task if they have participated in its planning. Overwhelming data show that participation in planning is important in later effective execution of the plans. Effective project managers would empower and facilitate team members' participation in planning. It's important to organize projects so that these projects and actions are in the long run self-interest of team members. This is not just about paying people to do the work, but also articulating how the proposed change will improve work life of the professionals involved, how it might affect their patient care, how it might affect their relationship to the other providers, and so on. In each case, it's important to list the benefits that the team members will personally receive. Overwhelming data shows that self-interest, if defined broadly to include benefits beyond pay, motivates professionals. But participation and self-interest is not the entire story. Many professionals who have suggested changes that are in their self-interest fail to carry them out. A project manager needs to do a lot more than articulate the pros and cons of conducting a project. We know from research on information processing that too much information is counterproductive. Human beings have a limit on how much information they can process. A project manager can help the success of a project by simplifying why a project is being done and keeping the message in front of professionals involved. Consider, for an example, health professionals engaged in reducing medication errors. They meet several times to understand what causes medication errors, and they perceive it to be in their professional interest to reduce these errors. They want to do better, but safety teams have a hard time reducing medication errors. The problem remains elusive because these errors are rare, and human beings, even experts and superhuman beings, have a difficult time to think about them. We asked members of a safety committee to estimate the frequency of various errors. They provided many estimates. They arrived at a consensus about these estimates. It all looked good until we looked at the data. All of the estimates were off. We asked them to list causes of errors. The causes they listed had no relationship to the causes that observed after analysis of the data. In short, when the problem is rare, our intuitions fool us. A project manager can help professionals in solving the right problem by making sure that relevant data are analyzed and at hand and the focus of the project. How the project manager explains causes of various events matters. Data and attribution theory shows that if success is attributed to employees and initial failure attributed to the environment, then the employees are much more likely to try again. Project managers can explain accomplishments of and delaying project milestones in different ways. If project team has to continue to work hard and accomplish the task, it's important that they feel optimistic about their chances of success. It's important that they see themselves as successful. This perception of success is important in eventual success of the project. This may sound funny to project managers that are focused on tasks, but what really matters to people is to have support groups. By support group, we mean people you can turn to and express your frustrations with the change. For example, when an employee goes to a conference. Change is more likely to occur when those attempting the change believe the people they respect are also changing, that these people want them to change and will help them succeed. Again, here perception is what matters. The support group did not do anything but only to listen and validate and express empathy with the person. People who are going through change need to believe that if they fail not only themselves but also their social support group. A project manager can provide for social support by putting together brown bag lunches where team members come and talk about their experiences. The project manager can invite people from outside to come in and discuss the same issues. In short, the project manager should create the environment in which support groups can flourish and help project team members. It's important for the project manager to keep the team motivated through use of various media. The project manager can use media in several different ways. Media can be used to repeatedly remind project team of the upcoming milestones. Media can also be used to highlight the reason for the project was undertaken in the first place. Often videotaping and audio taping patient experiences helps. Media can also be used to report progress of the project and celebrate success of the project. Data show that media advocacy, even when done with a small group of employees, is an effective tool in bringing about change. Project managers need to do a lot more than motivating project team members through appeals to self-interest. We have laid out a series of activities that can radically improve chances of project completion, including recognizing information processing limitations and staying with the central project message, attributing success to team members and failure to the environment, providing support groups to hear about team members' efforts, and using mass media tools to advertise to project team and their immediate personnel. All of these additional steps work without making a rational case for the change. They work because project team members need to feel good about the change.